everybody. My name is Mercedes. I'm the Director of Training and Strategic Initiatives for Smiley Aesthetics. This is my lovely assistant here, Kirsten. And I'm just going to go through kind of the entire process that I do with a client. New client, not new client, doesn't really matter, same process. Alright, so my name is Mercedes. I'm a registered nurse. What are you interested in getting done today?
I want Botox. I have really strong furrow right here, and I really want to not feel so heavy on my eyebrows. The past couple times I've gotten Botox, I have felt that my eyes don't literally droop, but it just feels heavy, and I want it to be like lifted and also like physically look like it's lifted.
Okay, so just a nice little brow lift.
Yeah.
Okay. And how many times have you had Botox before?
I have had Botox. I did get Dysport about 3 years ago, and then I went about 2.5 years without it, and then I got it done in March, and then I got it done in September.
Okay. And I mean, of course I'm going to do my own assessment, but do you just know how many units you typically get?
No, I have no idea how many units. I know when I got Dysport that I got 22.
Okay. And then how long does it typically last for you?
With those, it lasted about 2 months.
Okay. All right. And then what's your date of birth?
10/16/1997.
Okay. And then feel free to make up anything fake for the video, obviously.
Okay.
What else? And of course, email address and phone number is super important, and you want to get both of those. I have those on Kirsten already. Date of birth as well, which we got. And then we'll go through our medical history. Honestly, you can do it one of two ways. You can just go through with them question by question, or you can hand her the cell phone and kind of let her fill it in. And it just kind of depends on the situation. Botox parties, I feel like I'm like, hey, while I like assess the next person. So whatever's comfortable for you. So we're gonna do, since I'm acting like you're a new client, we're gonna do your good faith exam. Do you have any medical problems, current or previous?
No.
Okay, do you feel like you have any volume loss in your face?
Just a little bit of my cheeks, but nothing too crazy.
Okay. And is there anything specifically, like any area of your body aesthetically that you're displeased with?
I just think my weight has fluctuated recently.
Okay. And this one I don't really ask, like, necessarily, okay, I don't really see any skin infections in the area that I'm looking at. If they told me they were diabetic in the first question, I might ask if they have any infection anywhere else, of course. But I usually literally say it out loud. I don't see any infection, on your face anywhere, so that's good. And then have you had any Botox filler or facial surgery in the last week?
No.
Okay. Seems obvious, but, gotta ask. Have you ever had any side effects from microneedling or any other similar procedures?
Nope.
Okay. Do you use any products to protect your skin, like sunscreen, retinol, anything like that?
I use sunscreen.
Okay. And then have you had surgery before, including facial procedures?
No, I have not.
Okay. Do you take blood thinners?
Nope.
Are you pregnant or breastfeeding?
Nope.
Do you smoke?
Nope.
Any scarring problems like keloids?
Nope.
Are you allergic to anything that you know of?
Nope.
Any history of cold sores?
Nope.
Any autoimmune diseases?
Nope.
Myasthenia gravis or epilepsy?
Nope.
And you have had aesthetic treatments before,
Yes.
so I'm going to put in here both Dysport, Botox, any other aesthetic treatments that you've had?
Nope.
And then, okay.
Actually, I lied. That was lip filler. I've got
Lip filler, okay. No worries. It's hard to remember sometimes. I usually forget what I ate for breakfast, so. Did you have any side effects from the Botox or the filler?
No.
Okay. And have you had Accutane in the last 6 months?
Nope.
You pass out when you see needles?
Nope.
Okay, good. Sensitivity to cobalt or vitamin B12?
Nope.
Take any medication that affects your bone marrow?
Nope.
Kidney or liver disease?
Nope.
Folic acid deficiency?
Nope.
And this is specifically for microneedling, but it's just good for us to know this anyways. Do you have scleroderma?
Nope.
Collagen vascular diseases or cardiac abnormalities?
Nope.
Blood clotting problems?
Nope.
Immunosuppression?
Nope.
An active bacterial or fungal infection?
Nope.
Okay, and then of course we know the last 3 questions are for us. So I've reviewed the plan and the patient with the nurse practitioner. Obviously, we're going to go over her plan here in a second. I've performed a physical examination of her face. Totally, been doing that while we've been chatting, of course. And I'll end up doing more. And then of course, does she have Allie? You have Allie.
Mm-hmm.
Okay. And how'd you hear about us today?
I heard about you guys through a friend.
Perfect. All right. And any open sores or surgical wounds from the past 12 months on your face? I don't see any. Okay, perfect. All right, so I have a bunch of consents for you. They seem a little excessive, but I'll kind of let you know what they are. So this first one here is so that my doctor and my nurse practitioner can review everything. The second one basically says that, if something were to happen and you felt like there was a need to sue me, you can sue me, but you just can't sue Smiley Aesthetics, okay? The third one says that you'll pay for your services today. This one is actually optional. I do have to take photos of you, but if you want, or I guess if you give me permission to use them for like marketing or social media, I would have you sign that one. Okay. And then this one is for the Botox itself.
Okay.
So with the Botox, the big things are for the first 24 hours, no like crazy, like intense exercise.
Okay.
No hot sauna, hot yoga, or like a hot tub.
Okay.
And then don't like get a facial, lay on your face, get a massage for the first 24 hours. And then, I don't know who does this, somebody does, but we want to wash our face up and out. We don't want to go down, but someone has done it, so that's why I'm warning you today.
Okay.
And then other than that, you can pretty much do most everything normal. You might have like some little pinpoint bruises. It's truly rare, especially if you're not on blood thinners. And I do just always like to tell people, per the Botox itself, per the insert, 9% of patients can get headaches from Botox. Usually they're short-lived, like a week or two, sometimes less. And then 91% of patients do get a headache reduction, which is nice.
Okay.
And then since you've already had Botox before, this is not a problem for you, but for people that haven't, less than 3% of people can actually get fever and flu-like symptoms for 3 days after Botox, and you would just treat it just like normal fever and flu. Other than that, the big thing I like to let everyone know is, our muscles are, they can have different strengths in different locations, and so they're actually going to paralyze at different speeds. So during the time, that we were waiting for your Botox to set in, you could look a little, silly, right? Like I tell everyone, I look like a mad scientist from day 8 to day 12. Okay. And then by day 14, I'm like, wow, this looks amazing. So if you see anything funky until day 14, just ignore it. Don't freak out. It will most likely completely dissipate. But at day 14, if you still see something, then that's when I want you to reach out and we can do a little enhancement if we need to.
Okay.
Okay. Do you have any questions about anything?
Nope, none at all.
Perfect. So I'm going to have you read your dose, sign when you're ready. You'll just hit sign in the upper right hand corner.
Alright, there you go.
And then we will get your photos and a cute little video as well. So for this first one, just totally normal face. And if you'll turn your head that way. Perfect. And if you'll turn your head the opposite direction. Wonderful. And then the next part's a video for my nurse practitioner in position. And I'll tell you what to do in this one. It's just gonna be really quick. Raise your eyebrows, make your mad face, smile real big. Perfect. That was a big smile. That's cute. All right, and then I'm actually gonna text my nurse practitioner and let her know to review everything while we're kind of talking, and just to keep us compliant, of course, and then we'll go from there.
Okay.
And this is usually when I'm rolling on the floor playing with their dogs, of course. So any downtime I have, that's usually what I'm doing. Let's see here. All right. So I'm gonna have them look at that, and I'll just go ahead and kind of start getting you marked up here. All right, so I'm just gonna go ahead and clean these areas off while we're waiting for my nurse practitioner to let me know if we're good to inject. So you said 11's forehead and then a little brow lift, right? And you don't treat your crow's feet?
No.
Okay.
I've done my crow's feet done before, but I'm only 26, so.
That's fair. Smell real big again? Yeah, they're not bad, so I think that's totally fair. All right, I'll have you make a bunch of faces for me, probably more times than you want to, but want to make sure that I'm getting everything just right. All right, go ahead and make that mad face. Good. Okay. A really hard mad face. So you can relax for a second and then be super angry. Okay. So I pinch their corrugators and like move it. I'll do it from here. I like move it around and you can literally see the insertion on the bridge of her nose there. And I'm like, oh, cool. That's the corrugator. So I know there's her body there. And then relax and then close your eyes really, really tight. Now you can get really good elicit of that muscle. And so like corrugator right there, I can see that it's tugging here. So that's her tail. So I can do my other 2 injections right there. Perfect. Wonderful. And then raise your eyebrows real tall for me. And really, really hard, like you've never been so surprised in your life. So her Botox is not completely worn off. Relax and then raise again. And relax. Raise again. Okay. So it's really hard to see on my assistant here, Kirsten, because she's young and her Botox is not completely worn off. But this is going to be her line of convergence. So once I find that, I'm done. I take that off and I do my 2 dots above and my 3 below. And honestly, then I kind of reassess my dots and see like, is this where I want to keep it? So
I have a question.
Yeah.
So when you inject and the forehead does not move, but the eyebrows still move, is that because I've not received injections in my eyebrows, or is that because my forehead is strong?
A couple of different reasons.
Okay.
So you have this muscle here, your orbicularis oculi, that can move your eyebrows a little bit.
Mm-hmm.
And then you have these muscles, this glabellar complex, that can move your eyebrows.
Mm-hmm.
And then you also have your frontalis muscle that can move your eyebrows.
Okay.
So you just got a couple of different things controlling
Gotcha.
it. So that's a good question. And then raise your eyebrows again. So I like to make sure that I'm not going to spock anybody, right? So I kind of like to keep my most lateral injection kind of over the arch of the eyebrow, or what would be the arch. And then she specifically reported heaviness, so I like to do literally 2 units in the eyebrow, 2 units and 2 units in that area on each side. And I feel that can be really helpful, especially for people that have like hooded eyelids, and which she does not really. I mean, minor. Yeah, you do. Okay. Mm-hmm. Yeah, so that explains it. Hooded eyebrow clowns are honestly just really hard to treat. So okay. All right, so one of the ways I like to stay organized, so I know that I'm doing her frontalis, so like in my mind, this is the forehead, right? I've got a 12 and a 8 unit, and then I'm doing her glabellar complex, that's like the glabella. And then if I were doing crows, but I'm doing a brow lip, so I'm gonna do 6 units on each side, and that's how I kind of keep myself organized. All right, and I'm a little bit of a psychopath. You do not have to do what I do, but a lot of you guys ask for my process. So I always start with my 2 unit, my 8 unit syringe, and I start on the frontalis because this is an easy way for me to know I'm not gonna forget anything. So if you'll turn your head this way for me, please. So I do and I already cleaned her. All right, stick. I do my top injections first. Here's the psychotic part. Stick from left to right. I'm sorry,
no,
that
okay.
sucks. So I do it from left to right because that way I just know, like that's the direction that I read in, so I remember it easily. And then I do my 12 uniter. Same thing from left to right. Stick. Stick. And last one up here, stick. You cry less than Adrian, let me tell you. And then, okay, so I do the same thing, but in reverse. For my glabellar complex, again, you don't have to do this, but you guys ask. I do my 12 uniter first. And I come in here and I do my Proceris. So 90-degree angle, stick. And I do the body of both of my corrugators first, stick, because they're all deep injections and that just makes sense in my mind. Stick. And then, okay, all I have left there are my little, is my 4 uniter. And so then I can do my shallow injections. Stick. These are kind of spicy, I'm sorry. Last one here, stick. That one's extra spicy, I can feel it. You're doing good. Okay, so I've done that, and then all I have left are my syringes for my brow lift. And honestly, there's an injector out there, I forget her name, Lone Star something or another. And she has pretty intense hooded eyebrows and could benefit from a upper bluff. But this is what she does instead. So this is where I learned this from. So I do 2 units, stick, I'm sorry, here, stick, here, and then at the tip of the brow, stick. Perfect.
Oh, that was spicy.
Was it? Turn your head towards me, please. Thank you. So same thing on this side. Now, I don't like just arbitrarily do this on everybody, but I know that was her complaint, stick. And she has, she's got the heaviness, stick. She's got the hooded brows. And she's had that before, stick. So I know that it's going to assist her. All right. And then, of course, by this time, obviously, I missed this step. But yes, I had already texted my nurse practitioner. She, said, yes, I'm good to go. We had already done Allie with my client. And then at this point, honestly, I just kind of clean things up. I go back over the same discharge instructions that, I did before as far as what to expect, especially the 14 days. It will take a full 14 days for everything to set in. And then this is where I go to start check them out.